Welcome to the Bright Eyes Podcast, advice for healthy vision for all ages. Your hosts are Dr. Nate Bonilla-Warford and Dr. Beth Knighton, residency-trained optometrists providing eye care to all ages with exams for glasses and contacts and specialty services including vision therapy, myopia control, orthokeratology, and sports vision training. Their mission is to empower patients by providing the best in friendly, professional, and individualized eye care.
On location in Bellevue, Washington, this is Dr. Nate Bonilla-Warford at the 2018 College of Optometrists and Vision Development meeting, and it is the Bright Eyes Podcast. I have a special guest, Dr. Peter Shar, with me today. Hi, Peter.
Hey, Nate. Thanks for inviting me to talk to you on this podcast. It's a really great opportunity to talk about lenses.
Excellent. Yes, I am excited about this because there's a useful tool that we have in our office called the Shar lens, and I think that has some relation to you. Why don't you tell us a little bit about your background first, and then we can talk about the Shar lens.
So I started life as an optometrist with a degree also in physics and computer science, and I practiced for 35 years. But during that time, I came across a lot of problems created by glasses that are unique to the fact that glasses sit away from the eyes and not on the eye. And Shar lens is a comprehensive way of designing eyeglass lenses that eliminates the image difference, in other words, the size and image position that's common with many pairs of glasses made. So what we do is we actually design lenses based upon exactly where the lenses fit on the face, taking into account both the prescription and the underlying magnification that glasses create. So this fixes is something called anisoconia. And anisoconia is the optometric word that describes the image difference and results in the inability to put images together in the brain.
So one thing that I really like about the Shar lenses is I'm what I consider myself to be a binocular vision specialist, which means I take measurements and I measure how both eyes work together as a team. And one of the things that is unique about the Shar lenses is they are not just individual lenses, one for each eye, but they also take into account the way the eyes work together as a team. Do you want to talk about that a little bit?
Absolutely. So the way that lenses, ordinary glasses are designed is they make a lens for the left eye and make a lens for the right eye. And within the system that laboratories that manufacturers use, there's no way that those two features are never correlated. In other words, they don't take into account the effects that individual lenses have upon the eyes. What we do is we look at the prescription and the way the glasses fit and design a system that eliminates the obstacles that normal glasses create. These two obstacles come about because of a natural aberration of glasses. They make things look bigger and sometimes smaller. And when the prescription is slightly different, frequently the image size difference and the effect the glasses have upon the we call gaze direction interfere with the ability of the brain to keep the images together. We call that fusion. So regular glasses often cause a breakdown of images being together and staying together as the eyes look around. And the Shar lens design is called isotonic lenses, or sometimes isophoric lenses, can be designed to eliminate that image difference and provide comfort and function that regular glasses can't attend to.
So what type of patient can benefit from these types of lenses?
Well, every patient benefits from having isotonic lenses. Not all patients require the added technology, but it never hurts. Where we do really well are patients that have come across a different eye prescription due to surgery, like cataract surgery. Patients who are born with their eyes are different and just happen to start wearing glasses. Patients that are new to progressive lenses or bifocals. When we hit 40, we have to start wearing glasses full time. We're especially helpful for kids with lazy eye. We call it amblyopia. Amblyopia comes about, we think, as an active inhibition of one eye because the images created in an amblyopic child are different in each eye, and they fight for attention. So the kid ignores the one image. What Shar lens does, it equalizes the images so the eyes can blend the two images together and they don't have to fight for attention.
And we've seen incredible benefits for certain patients, especially the younger children who might have amblyopia, as part of our vision therapy program, or even if they're not enrolled in the vision therapy program, the benefits that we've seen from use of the Shar lenses has been really remarkable, really, really exciting. Tell us what kind of research has been done using the Shar lenses?
Well, research has been done both in published papers on isotonic therapies and also on a few cases that we have with our partner universities. And we're currently doing a research project of a double-blind study. But our research is a little simpler than that. We've been selling and providing optometrists with Shar lens now for 6 years. And our market share in treating amblyopia has dramatically increased from when we started. And I put that down to the fact that doctors see the difference. And that's the best research we can have. It's unbiased. No one gets paid to use our lenses. There's no subsidy. It's organic. And if a product wasn't working, it wouldn't be happening. What we do know is that anisoconia has been known about since the 1850s. And it's been talked about routinely, but making what we call isotonic lenses for some reason hasn't been done until recently because it's been an arduous mathematical chore for optometrists to design lenses. So it doesn't get done. What I've managed to do is to simplify the process of ordering isotonic lenses. And what an isotonic lens is simply a lens that equalizes the images. Now, we can make assumptions about patients, but laboratories that make glasses are just fulfillment houses. They don't really design lenses no matter what the marketing says. What they do is they put a prescription lens in a frame that gives clear vision, but no one talks about the interaction between the two eyes. And what I'd like to say, what I will say, is that the difference in the eye measurement units we call diopters doesn't have to be very big to disrupt how eyes work together. And especially with kids with amblyopia, there the issue is these kids are really good at shutting off one eye. So any excuse they have to shut one eye down and only use their one, become monocular, so to speak, is triggered by small differences. So we don't have to have a very big difference between the two lenses to make a huge impact on how that patient sees. One example is, for some reason, traditional eye care tends to minimize approaches to therapies that they don't understand. So there are some rules sometimes where it should be 3 diopters or more to consider isotonic lenses. Personally, I disagree with that. I think there is no difference small enough if the optometrist can measure a loss of depth perception or a loss of acuity. If the patient's not functioning well, there's something wrong. And I think we should use any treatment available to us to try to remedy that situation and fulfill our role as doctors to treat the deficit, not pass it off as something the kids should get used to.
So if you're a parent or a patient considering Shar lenses, are there any downsides or other things that they should know?
Well, the only downside is, yes, they cost a little bit more. And the reason for that is that our lenses are all custom designed like a custom-made suit for the child. They don't come out of an envelope already made. And that comes about because cost of production, the lenses are always made in the country where they're dispensed. So, for example, for the U.S. market, Shar lenses are manufactured in a U.S. facility. Another downside is sometimes one lens might be a bit thicker, which is similar with any prescription that's therapeutic. We use prisms sometimes. That makes the lens thicker. So thicker lenses may be not as cosmetically attractive, but that hasn't been an issue, because what we're looking for with our design is a medical therapy for amblyopia and strabismus, and making kids more comfortable with their glasses on. And I think those are the only two downsides that I come across. The upside is that it provides a great foundation for better vision and increased efficacy from vision therapy. So what we provide is a good foundation for your vision therapy eye doctor to help your child gain better, more efficient vision using both eyes and increase their reading ability.
Well, I definitely use the Shar lenses when I think that the patients would benefit, and I've seen a lot of success. Before we wrap up here, is there anything else that you'd like to tell our patients?
The most important thing, I think, to remember is that we're not a radical treatment. We are a rational treatment. And the vision that you get with the Shar lens is never worse than you'd get from an ordinary pair of glasses. It can only improve things. We don't use patching. We don't use anything that's not scientifically valid. Our advisory board is made up of ophthalmologists, optometrists, and researchers. And we don't have any smoke and mirrors.
Well, this has been a great meeting here in Washington State. I thank you, Peter, for giving us your time, and I hope you have a wonderful meeting as well. For all patients who are listening, if you have any questions or comments, you can always reach us at office@brighteyestampa.com, and we look forward to bringing you the next episode. Thanks, Dr. Shaw.
Awesome. Thanks, Nate. Thanks, Dr. Walford. Thank you.
Brought to you by Bright Eyes Family Vision Care and Bright Eyes Kids. Find previous episodes and more detailed information at brighteyestampa.com. Creative Commons copyright attribution, non-commercial use. The only purpose of this podcast is to educate and to inform. It is no substitute for professional care by a doctor experienced in the area you require. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Please consult your physician for diagnosis and treatment.